I like to get up early. I work early, but a lot of times I like to exercise. So have my breakfast and head to work to get there about 7 o'clock in the morning. My first patient's at 7:30. I want to make sure that I have everything set up for all my patients. A lot of times once you get going in the day, things get a little crazy, a little busy. I like to make sure that I have all the patient's charts in my room. I like to go through the schedule and see who's going to need x-rays or kind of troubleshoot any issues that we're going to have. Does the doctor need to talk to this patient about this? So just kind of make a plan for the day. From 7:30 to 1 o'clock, we typically see about 5 patients. And each patient gets an hour to an hour and a half depending on what issues they have, or if they're coming in for just a regular cleaning, or if they're doing more intensive treatment. If it's a new patient, they get more time because we do a full set of assessments and make sure we know the whole story. Typically we go through the same routine at each appointment, where we talk about any changes the patient has had. We check the gums, take any x-rays if we need to, and then do a thorough cleaning and have the doctor come in and do an exam and check for any problems. I love the new technologies that are coming out that make our work easier and make it more effective. We get about an hour for lunch at my practice, so we usually bring a lunch and we have our social time. After the last patient, I like to do any setup that I can do for the next day before I leave, and just clean up and head home. When I leave the office, I'm done. And that's why I try to prepare as much as I can before I leave, but then, I can't do anything from home. It all stays at the office. When I get home, I have to go pick up my kids from the after-school program, and then we head home and make supper. And then my husband comes home a while later, and we have dinner and do homework and go to bed and get ready to do it all again the next day. On the weekends, my family, we really like to bike. So we take long bike rides and picnics. Looking into the future with my practice, I love getting to know the patients over time. They just become like your own family. The more you get to know them, the more you can help them. That's just a very satisfying part of this job.